Howdy folks, it's Dr. Steve here coming to you from CrossFit Deco here in Denver, Colorado, and we're going to talk a little bit about hip flexor mobility today. One of the things that tends to cause my patients a lot of problems, and fellow CrossFitters as well, is tightness in their psoas, iliacus muscle, and the rectus femoris, which all together kind of group as our hip flexors. Basically what a hip flexor means is it's a muscle that allows us to take our leg from being straight up to here like this. And if those muscles get tight, it makes it really hard for everything to move the way it should, and it oftentimes will cause a lot of pain and stiffness as the days go on. So I'm going to show you guys a couple of stretches, easy ones for you to do there at home, as well as a couple of mobilization exercises using the bands that can help assist you in kind of breaking down some scar tissue and stuff inside your hip joint that might be causing you some restrictions and pain. So let's get started. First things first is the traditional type of hip stretch that we usually do is going to be here in the lunge position. So when I'm down here like this, I'll be stretching here on the right side. What I want to make sure that I'm doing, and I see a lot of people doing wrong, is keeping my chest nice and tall. So if we're looking from the side, I want it to be here, not here like this, and at no point during the stretch do I want to see this hyperextension going on through there, because it kind of is counterproductive to what it is that we're trying to do. So what we want to do is get here into this position, make sure that our core and everything is nice and tight, and that we're just sliding forward, dropping that hip down towards the ground, and you should feel a nice stretch all the way through the front side right here. If you want to get that stretch a little bit deeper, what you can do is throw your arms up overhead and bend away from that back leg, which is going to help open that up even a little bit more. For people who can't really get down on their knees so much like that, what I recommend them doing is putting a foot up on top of a step or chair or something like that that will allow them to get into this sort of scissored position. And this time we'll actually be stretching the left side. Same sort of thing. We're just going to keep that back nice and tall, and we're going to lean in. And you're going to feel that same stretch right at about there. And you can do that same sort of thing, both sides, make sure that everything is nice and stretched out. For those who want to get a little bit more deep into the stretch and get a bit of capsule work, you can attach one of these bands to a rig or something that's nice and strong so it doesn't fall over. We're going to make sure that the band is lined up about to hip height here like this. Step into the band, pull it all the way up in towards the groin and make sure it's nice and solid in there. Get back into our stretch, same sort of thing, and we're just going to use that band to assist us here a little bit, give a little bit of extra pressure. So what I would do is make sure that we're using the band in each direction against the hip capsule. So we'll spend some time here in this forward direction. Then we'll spend a little bit of time letting it pull to the side here like that. Same sort of thing, just work it into there. And then we'll let it come from behind here a little bit like this, arms up overhead. Same thing, bend it away. And then we'll switch to the other side, same thing, stepping over it. And just let it kind of work out all of those points for a hip capsule. Basic recommendation is to work on all this stuff for at least about 2 minutes at a time. That way that we get some hip capsule changes in there, and make sure we're working on this pretty frequently. Otherwise it'll tend to go back right where it came from. As always, if you guys have any questions about anything, feel free to get in touch with me at the clinic, and I'd be happy to answer anything for you. Okay, take it easy.